of the things that happened in the aftermath of September 11th, specifically with the anthrax scares that occurred, was that public health was sort of brought to the forefront and helped people to recognize what the face of public health is all about. But the bottom line is that we've really been there all the time.
Public health, a vital part of people's lives every day, ensuring a safe food supply, safe drinking water, and that Americans of all ages are protected from contagious diseases. Public health professionals recognize that every community has the right to good health and are on the front lines promoting a healthy lifestyle, including good nutrition and exercise. Whether you're at home, at work, or at play, the face of public health and public health policy is working.
Every day in public health, we have epidemiologists and sanitarians and disease investigators who work day to day, every day, not just on high-profile issues, but dog bites and possible rabies exposures and possible West Nile exposures and meningitis. We also have health centers in the communities. We also have nurses who make home visits who go into the community every day. We have health educators who work with children and work with adults. The face of public health is everywhere.
Much of the work in public health is behind the scenes, where researchers study health problems and develop and test ways to protect people and prevent the spread of disease. Do jogging paths result in increased physical activity? Are clean air regulations reducing the rate of asthma? Answering these questions has led to new public health policies, interventions, and guidelines that make our communities safer.
Policy development is one of the three core functions of public health, and it's extremely important in terms of making sure that we are protecting the public's health. Some examples of that would be seatbelt laws, helmet laws, nutrition labels. It also involves environmental issues, safe housing, making sure that your work site is safe, and these policies are very important and have played a great deal of a role in terms of making sure that people have a longer life.
Promoting good health and helping people in your community. This is where you'll find the face of public health every day.
But we also have public health workers who are community outreach workers, who speak lots and lots of different languages, and their contribution is to help to translate the kind of health information that can be so important to keeping people healthy.
Yo soy el representante de la salud pública. I am the face of the public health in my community. I think this is the most important part of working in the public health. You can change lives. We can improve our society and try to demonstrate the healthy people can be better fathers, better workers, better part of the society. It's so amazing how these people need just a little guidance. You can change all the destiny of them.
We all take it for granted that our food's safe, our water's safe. The sanitarians start kind of behind the scenes even before someone builds a housing project or develops land or builds a restaurant to try to make sure that that's built in the most safe and environmentally sound way so that it doesn't have a negative impact on the environment. Other aspects of sanitarians' work would involve water supplies, recreational waters, housing, safety, for example, lead paint abatement. Almost anything that people can be exposed to, we try to keep some tabs on to make sure that there are not environmental hazards that are going to pose real public risks.
I do have the opportunity to change people's lives every day. Every day. When you see someone whose life has been transformed because of an intervention, and you realize that they're different than they were a year ago, or they come out and spontaneously thank you for the fact that they have a job and they hadn't had a job for 5 years. So you get this feeling, maybe this one particular individual was your purpose for the month.
I think every day being with the elderly people and being able to help them to make a choice makes you feel good. I think we promote health every time we go into someone's home because we're always looking at every possible thing. We're doing home safety evaluations, we're doing education with a caregiver. What we're doing is preventing future hospitalizations, preventing ending up in a nursing home. I don't think I've ever been so proud of what I do because I feel like I really make a difference, and I make a difference to people every day, and I actually get to see it.
I see a diversity of individuals, and I enjoy talking with them and helping them to look at what they're doing in terms of nutrition and physical activity. Right now, we're looking at an epidemic with obesity. And certainly when we begin to look at our young children, we do need to broaden the legislative matters into looking at what restaurants are doing, food companies are doing. All of this is going to lend its hand to better protection for the consumer.
Health in the schools is a very big issue. Children come to school with many illnesses that 5 or 10 years ago you really didn't see very much. And sometimes teachers need to be educated about how to manage those children in their classrooms. And the children, again, need to learn how to maybe manage some of the conditions. And we're there to assist people to go beyond perhaps and really optimize their health and their well-being. So when you see people like me, I am public health.
Trust is a major part of my job. Information is one of the most vital, most important vehicles used in prevention. It's a mechanism where you need to provide them information and knowledge and knowing, and you're hoping out of that knowledge maybe they'll make a better choice in the long run. If I can help the public and they can have a better lifestyle, and it may be because of me, that makes me feel good.
I get to serve people who have tremendous mental health needs. People call us when they are at wit's end and they've used all of their coping skills and support systems, and I have a chance to work with that person and help them change their behaviors and hopefully allow them an opportunity to have a positive change in their life.
As public health looks to the future, we recognize that a healthy America is dependent on health conditions worldwide. The recent outbreak of SARS around the world illustrates that public health is a global issue. Looking to improve health around the world has underscored such important health objectives as peace building and protecting the economic and social systems so critical to good health. Human rights clearly include the right to good health and a long life. Healthy living conditions and access to quality care are part of that guarantee. And the face of public health will be there, working for all of us, now and in the future.